Welcome to the Bipartisan Policy Center's preview of healthcare policy in this election year. I'm Marilyn Serafini, and I'm the Executive Director of the Health Program here at BPC. Policymaking is difficult in an election year, we all know that, yet healthcare is on voters' minds. And there are areas within healthcare that many Republicans and Democrats are ranking as top priorities. Generally, healthcare prices and costs, more specifically, the enormous unmet need for mental health and substance use services, the financial strain on rural hospitals, which is leading to continued hospital closures or the loss of important services at those hospitals. We have some extremely knowledgeable experts with us today, and they're going to help break this down for us over the next hour. At any time, please feel free to submit questions using the live chat function on YouTube and via X, formerly Twitter, using the hashtag BPCLive. So let me tell you how the next hour is going to work. First, we're going to hear from Rachel Newsom, who is the Senior Vice President for Federal and State Health Policy at the Commonwealth Fund. And we are certainly grateful to the Commonwealth Fund for its partnership and generous support of BPC. After that, we'll go to Alice Miranda Olstein. She's a respected healthcare reporter for Politico, where she leads the team's Capitol Hill coverage of federal policy and politics with a focus on reproductive health. Alice is going to moderate two discussions. The first is with leading pollsters who will help us to understand public opinion around healthcare and what that means for the upcoming election and for policymaking this year. Bob Blendon is Professor Emeritus at the Harvard T.H. Chan School of Public Health, and Jarrett Lewis is a partner at Public Opinion Strategies. Both of them are fellows here at BPC. After that, Alice will lead a second discussion with two of BPC's senior advisors. Chris Jennings is president and founder of Jennings Policy Strategies. Chris led healthcare efforts for both Presidents Clinton and Obama in the White House. Sheila Burke is a strategic advisor at Baker Donelson. Sheila has her own connection to healthcare as a nurse, and she was also chief of staff to Senator Bob Dole when he was both majority and minority leader in the Senate. Alice, Chris, and Sheila will explore election year dynamics, congressional priorities, and the administration's agenda for health issues. So now I will turn it over to Rachel Newsom.
Thanks so much. Thanks so much, Marilyn, and good afternoon, everyone. On behalf of the Commonwealth Fund, thank you for taking the time to join us today. The Commonwealth Fund is a century-old, nonpartisan foundation focused on investing in solutions to some of our most pressing health policy challenges, such as healthcare costs, coverage and access, behavioral health, delivery system reform, health equity, and many more. You can learn more about us and our products at commonwealthfund.org. We're proud to partner with the Bipartisan Policy Center to bring today's conversation to you. We have a terrific panel that Marilyn just laid out, and they're going to help you understand and frame what we can expect to see over the course of the next year. So many thanks to our panel for making the time, to BPC for their partnership, and to all of you for spending your lunchtime with us. With that, I'll turn it over to Alice.
Thanks so much to our knowledgeable speakers for making time to share their insights with us. We're going to dive right in and make the most of this time we have and welcome your questions, submitting them on YouTube or X. And so let's first hear a little bit from Bob and Jarrett on what they're seeing right now in their polling work as it relates to public opinion on healthcare issues. And what could that mean when people start voting later this year?
All right, I'm going to try to make 5 points that'll sort of shape where these issues are in the election and how it's going to play. I want to deal with the mood of the country at this time, the top election issues as people report them, the top healthcare issues that could appear in the election, and the underlying values that actually shape in today's world how people think about issues that are being debated. And lastly, the unique role of Medicare, which could appear in the election or clearly would be prominent right afterwards. In terms of the mood of the country, and I apologize to experts who are listening, The American public in polls is so far from what experts think is going on in this country. It's as if you're polling in a different continent. So the people that we poll are pessimistic about the future. They are very short term. They are not interested in what was passed by President Biden that goes into effect in 2026 and 28. They just pay absolutely no attention to it at all. And also, we'll return to this later, when you ask what's important to them are things that affect their family directly. So it's not about, I'm really worried about everybody else in the country. They're incredibly worried about their own family situation. And so to the degree issues do that. The top election issues just from last week, inflation is by far the dominant issue and the economy is part of it. But healthcare is there, depending on your list, it's 3 or 4 for that. I have to mention abortion. It is a very special issue and shows up differently. People do not define abortion as a national issue facing the country. For 28 to 38 to 30% of voters, it is a personal issue where they cannot vote for a candidate that does not share their views. And so if anybody mentions abortion in the national election, those 28 to 30% of voters will vote on that issue. If they don't mention that issue, they'll return to inflation or healthcare or schools or whatever it is. But it doesn't show up as a top issue when you give people a rating scale. But that 28 to 30% are absolutely passionate about it. When you ask what are the top healthcare issues, it turns out that prices and affordability are just overwhelming. Likewise, when you ask families, I'm worried about inflation in my family, healthcare shows up on the list about what they're worried about. It's either prices or they don't have coverage. But it's basically, I can't pay for it, it's too expensive, I can't afford it. That's the issue in people's minds in a very short-term way. In terms of the top health issue, basically opioids and fentanyl are the dominant issue. And what's worth knowing, my talk 5 years ago had cancer as number 1. So this is a recent occurrence. And when you just say to people, what's the top public health issue? They basically say opioids and fentanyl. It's just really struck everybody and it will show up in proposals. The fourth point I need to make is, and this is very hard for a lot of people, in the last 5 years, the country has moved further apart and become incredibly polarized. And rather than they like this issue or they don't like this issue, there are a set of values that really set the two parties apart. And the issues emerge from the values, and we can have examples, discussions later. But you can see this issue emerges. It makes no sense because it doesn't show up on a list, but the politicians pick it up because it highlights a value. So where are the value differences that really matter? First is in federal spending, simple as can be. Republicans believe that we're overspending as a country and it's leading to inflation. Number one problem. Democrats don't agree at all. They think we need to spend more to solve the big problems facing this country. The role of the federal government in solving problems. Democrats believe we have to do more. The federal government is not solving. A lot of people say it's not doing this, it's not doing that. They want to do that. Republicans think the size of government's got federal government way out of sight. There's too many issues. We have to reduce the size, and the federal government has to get out of people's lives. Businesses, this or that. The Republicans believe the states should have a lot more deciding what happens to health policy in the United States. Democrats really believe this is a federal issue. Basically, the federal government decides what we're going to have for health policy, not states. But the parties completely disagree on this. On the question of universal coverage, regardless of where we go, this or that, Democrats believe that the federal government should make sure everybody has a health insurance policy. They can't agree what that policy should look like. Absolutely should be covered. Republicans say, absolutely no, this is not the role of the federal government. We should not be covering everybody. In terms of the ACA, which is clearly more popular than it was enacted, you have two different views. The majority of Democrats think we have to enlarge the ACA in the next term. It's not, I don't know, is it popular? I want to cover more people. We have to get this done. Republicans don't want to repeal it. They do want to cut it back for them. So somebody who's talking about repeal in the election is going to run into problems because A, it's not a top issue for either party, and B, nobody wants to totally repeal it at this stage. The next value, and this is unusual, this is not true in the history of the United States, public health and epidemics have generally been non-political. We're now in a situation that not only has public trust in the aggregate fallen for public health institutions and agencies and scientists, among Republicans, it has hit rock bottom. Republicans, in terms of, do I have confidence if there's another outbreak in them? Do I have confidence in the information they're giving, etc.? Okay, now switch to Democrats. Democrats still have confidence in public health. They have confidence in medical scientists. They have confidence in universities. So there's a totally different view, but we get to how should we fund public health, or should we enlarge this or do that? You have to realize they start out where one party is, I don't trust these people. The other is, of course, I trust them, but we have to build them up and get it done. And the last issue I want to mention, because it shows up in all types of proposals in the health field, and it's very important, but the differences are real. And when you realize that, you can see the conflicts that are going on or not. And that has to do with the concerns for racial equity in this country. So Democrats, the majority of which believe it is critical, not just, but it is critical that we address racial equity in this country. For Republicans, not only don't they agree on that, it's at the bottom of their priority list. They do not think that this should be a focus of the next administration. And so various issues show up, DEI, this or that, but they're really reflecting very broad values about how critical is it that we address equity for this, and the parties don't see this. In terms of my, just the last point, unique role of Medicare, politicians and others often get in trouble. They don't understand Medicare and Social Security are the two most popular programs in the United States. They lump them with 5 other programs, social programs, social welfare. They're not. The two are different. They're different because individuals pay into an account for their own retirement. This is not a policy to help other people. It helps the elderly. No, it doesn't. It helps you when you're elderly. It helps your parents. And so there are two things you have to know about Medicare. It is the second most popular program for both Republicans and Democrats. Secondly, both Republicans and Democrats don't want to cut it. So they're aware there's a financial crisis somebody has to deal with down the line. They do not want to cut these two programs. If no politician says a word in this election, it will not be an issue. But if one party decides that they woke up in the morning and they really want to cut Medicare to future everything else, they're going to find themselves with an incredibly unpopular issue. In terms of the future of this program, people like our bipartisan group and all have to realize this cannot be dealt with in an election context. It has to be dealt with after an election when people aren't there, and there are going to have to be a lot of painful compromises because people know there's something wrong. They just don't want to cut the program back, and they're willing to punish people if they try to do things that are harmful. That's sort of a picture here, but I just want to close with just the first point. People are pessimistic. They're incredibly short-term. And when they hear issues, they say, how does it affect my family? So there are a lot of issues being discussed which are important, and the people whose families will care about it. But at the moment, in the polls, they're just saying, does this help my family or not? And then they're moving on. And if they don't, they just don't pay attention to it. That's sort of our snapshot of where we are.
Thank you so much for that. Jared, is there anything you want to add before we jump into some questions?
Yeah, so first of all, thanks to Bipartisan Policy Center for putting this on. And Alice, thank you for doing this. And I'm excited to get into the discussion. But I'll just hit a couple points, kind of following on from Bob's great remarks. Just starting at where he ended and where he began as well, and thinking about just the overall pessimism of the electorate more broadly than healthcare. But we are living in the longest sustained period of pessimism that we've ever measured. I mean, the last time that a plurality or majority of Americans thought that things were going in the right direction in this country, and right direction, wrong track question is sort of the Dow Jones Industrial Average, so to speak, of the U.S. political environment. The last time we saw a majority or plurality of Americans say, hey, things are going in the right direction, was 20 years ago this month. It's been 20 years since, it was January 2004 was the last time that we saw that in the data. So, what that means is, we've had a lot of change elections since 2004, where either the House, the Senate, or the White House flipped because of this voter pessimism that we have. And I don't expect this year to be any different, however that may break. Voters are extremely pessimistic about the economy. We're seeing numbers right now that are worse than the Great Recession. 66% of Americans have a pessimistic view of the economy today and a pessimistic view of the economy in the future. And so there's these kind of numbers, I think, sort of set the course for what we're going to see the election really be focused on. And kind of echoing what Bob's point is, healthcare, it's not 2010, 2014, or 2018 where healthcare was a number one or number two issue. I mean, recall in 2018, 40% of Americans or voters said that healthcare was their number one issue, and those voters broke pretty heavily towards Democrats in the wake of the Republican efforts to overturn the ACA. It is a fourth, fifth, sixth issue somewhere in the issue set where Bob is exactly right. Inflation, immigration, the economy, those things sort of supersede healthcare on the issue agenda. That being said, some of the other data that we're seeing with respect to healthcare leads me to believe that healthcare will be a top issue, whether it's 26 or 28 at some point. It just may not be 2024. There are pockets of healthcare issues where you're going to see campaigns really try to leverage voter sentiment, voter opinions on sort of micro-targeted or particular groups. I mean, the biggest one that we all know is abortion, and Bob's right. It's not an issue that shows up in a big way on the national agenda, but it is one that voters react very much to. And we obviously have seen in Ohio and Kansas and other places, that it be that kind of issue. I know we're going to get into that a little bit more, Alice. We are seeing, and it's been very interesting over the last couple of election cycles, the rise of single issue voters, where if a candidate is not in lockstep with them on one issue, and the top two issues for that are abortion and guns, if a candidate is not with them on that issue, it doesn't matter what the rest of the candidates' positions are. They will not vote for that candidate. And so we kind of have seen a growth and elevation of that, and looks like that could continue. When you get into specific healthcare, Bob touched on this. It really is about lowering healthcare costs, and it's not even close in terms of the healthcare issue agenda. Voters are extremely frustrated, exasperated by healthcare costs in this country. Almost 40% of Americans have skipped or delayed care in the last year because of costs. More than 40% of Americans say that they are extremely or very worried that one illness or accident or some sort of medical event will put them into bankruptcy. And so the cost of healthcare is something that is very near and dear to so many voters and so many Americans. That is the number one healthcare issue. I would keep a little bit of an eye on a couple of other areas. We are seeing increased frustration with access. I think that sort of corresponds with what we've seen with provider shortages around the country over the last couple of years. Certainly, brought on by COVID and just a lot of exhaustion and early retirements or leaving the industry. Those types of things. We're seeing a lot of frustration. People sort of feel like it's taking longer to get in, and to doctors, that sort of thing. We're seeing a little bit of slippage on quality. Gallup, for the first time last year, found that just 48% of Americans rated the quality of healthcare in this country as excellent or good. That was the first time in 20 years of tracking that they had seen that number slip below 50%. It historically had been high 50s, low 60s, and now down to 48%. That's an area where voters have always sort of felt we have the best quality in the world, but if you can't access it or it costs too much, you might start to shift your views on quality. And that's been interesting to sort of watch that evolution. Finally, Alice, just to kind of from a big picture on healthcare, and I talked about this, just the frustration with the U.S. healthcare system that voters really have in this country. More than 3/4 say that the U.S. healthcare system is in a state of crisis or has major problems. 55% disagree with the statement that healthcare in the U.S. offers good value for the cost. When I talk to voters and focus groups around the country, they say things like, I've become accustomed to hearing about rising healthcare costs, but I never see an increase in the benefit allotted to myself as a patient. Or people should not have to lose everything when they get diagnosed with cancer. Or just the current state of healthcare in the U.S. is pretty terrible. And those are kinds of things that I hear, which is why I'm sort of led to believe that it will again be a dominant issue in a subsequent election cycle. To kind of end on a little bit of a positive, the one area where it's been very interesting to track this over the last couple of years is behavioral health. That is an issue where there is very strong bipartisan agreement that there is a mental health crisis in this country, and something needs to be done in a dramatic way. And Bob talked about the opioid crisis. That obviously is part of the mental and behavioral health crisis in this country, but it's obviously, there are other issues as well that encompass that. And there is a lot of agreement on both sides of the aisle, Republicans, Independents, and Democrats, that something needs to be done, and they're ready to see some action taken on that.
Thanks so much. So, going off of what you just shared, I'd love to hear briefly, you talked about the healthcare issues that are breaking through and resonating with voters, even if it might not be dominating this particular election cycle. But as we know, the voting public is so varied. So I'd love to hear, which demographics are very invested in these healthcare issues that you flagged, and are they the voters who could decide the election, or are they sort of the reliable base that will turn out no matter what? And I know this breaks down differently between the folks who are focused on health costs versus the folks that are focused on abortion versus the folks that are focused on opioids and addiction. So just a few thoughts on that, on where we should be watching.
Yeah, I'll go, and then Bob wants to
Go ahead.
chime in. So it's a great question, Alice. Each of those, I think abortion is the biggest one. I'll come back to that, but I'll start with, Bob talked about entitlement reform. We saw at the tail end of the 2022 campaign, Democrats in a couple of Senate, in a couple of states, competitive Senate races, they ran, advertisements against Republicans who had kind of let themselves talk about Medicare reform or Social Security Medicare entitlement reform. And it wasn't nearly as big of an issue as abortion in 2022, or inflation for Republicans, abortion for Democrats, in terms of what they were focusing their messaging around. But it was, I think, effective in some states. And so I think you could see that as a potential way to focus on seniors. I think prescription drug costs, you may see, the Biden administration or Democrats talk about, the IRA, and particularly the Medicare price negotiations and trying to bring down drug costs, because that is an issue that does resonate, in particular with seniors who are, obviously oftentimes many are taking, several, expensive prescription drugs. I think opioids is one. More than 40% of rural voters say that they themselves or a family member has a current or has had an addiction to opioids. So I think you could see kind of focusing on, rural white voters in places like Wisconsin and Ohio, Florida, for around opioid messaging, or trying to meaningfully address it and get our hands around it. Abortion is the biggest one, though, and I think you're going to see this year Democrats continue to run what's been a pretty effective playbook on abortion in a lot of these key states. I think looking at attempts to get on the ballot in some states, making a ballot initiative. Obviously, what we saw in Ohio in November, what we saw in Kansas, last summer. It is an issue that is very potent and effective for Democrats, and I would just expect them to continue to run that. And it's women, but I think it really can resonate with younger men. It can resonate with a lot of different audiences. But I think you're likely to see kind of the suburban, women, white women, or urban African American women. It really, abortion is just an issue for Democrats that is very effective. And I think you're going to see it used in a lot of campaigns.
Yeah, and Bob, any other thoughts on, whether it's by age or race or geographic location?
Quickly on the abortion thing, a critical question is if the Democrats run on a national law that would be passed, it will make it a much more important issue among the people Jared just said. So it's no question in state referendums, you're going to win on this. But whether or not anyone's going to discuss, they're going to do something about it in the federal election is really critical. But if there is a bill to do something about it, it will really take those voters and make sure that they're not voting on anything else. So that will be critical. On opioids, what makes the bipartisan possibilities unbelievable is it's rural America and central cities. So you have Democrats in cities and senators from rural states that absolutely agree we have to do something. So what's important about the issue is they haven't figured out what to do about it, which is really important for that. To no surprise, I can't afford to pay for it issues and prices doesn't affect upper income people. So upper income voters are not voting on the price of my insulin is too high. It turns out to be moderate and middle income voters. Likewise, food prices, etc. So inflation hits middle and lower income people very hard, and it shows up. Medicare, I'm going to vote you out of office, is for people over the age of 50. They are absolutely threatened out of their minds. People age 50 are thinking about their retirement already. And suddenly you're telling them we're going to cut back, you're going to have to wait years, no, we're not going to pay this or that. And so over age 50, you really absolutely vote it. And the minute you say that's an issue in this election, you're going to get people who might have leaned more conservative to be very, very concerned about voting for anybody that would actually cut back.
That's a great point. And on opioids and addiction, it's so true that you do have both parties talking about it, but Republicans are pitching sort of a very law enforcement centric approach, sort of returning to the older war on drugs model. There's a lot of focus on the border and immigration and drugs, whereas, Democrats are more focused on the treatment, sort of a more healthcare approach side of things. And so it'll be interesting to see which of those really resonate with folks. You talked so much about how politically potent abortion is still continuing to be. And just in case it doesn't look like it's fading from anyone's mind, but just in case it does, we could also have the Supreme Court swoop in this summer and remind people what a big deal it is. So would love to just briefly hear, what the political impact, we had obviously the ruling overturning Roe versus Wade come down the summer before a major election, and now we're set to have something similar in a presidential year.
I would just want to repeat the same point. In order for an issue to be important in a national election, candidates have to run on solving the Supreme Court problem. So it's not enough they're going to be depressed, people are going to do this, but one of the candidates running is going to have to say, I'm going to pass a law that's going to make that drug legal. Then suddenly you say to people, stop how you're going to vote, you can change this. But otherwise, you're going to have to press, the ratings of the Supreme Court will go even lower, blah, blah, blah. But that doesn't mean the candidate's going to win. Candidate has to have a position that would reverse what the Supreme Court was doing or supports what it is. But what's critical is people have to have something tangible that they're voting for. So in Ohio, it's on the referendum. Right there. If I go and vote, I can change what happens here. So the critical thing is likely Democrats and President Biden come out with a saying, I want a law that's absolutely going to make these drugs available. Let's stop this. You elect me, we'll get this law. Then it really will become a voting issue in the next election. But it isn't enough just to have a negative court decision. The party has to take advantage of it in the running in the election for it to have an impact.
Yeah, and just to remind folks, what the Supreme Court will be ruling on will have a national impact. And so I know that in past years, there's been, you know, what people have referred to as a believability gap, or people thinking, oh, yes, you know, these things could happen, but that won't affect me because I'm in a blue state. That's a problem over there. So what the Supreme Court could do is, put restrictions on abortion pills that impact everyone, whether you're in New York or California or Texas or wherever, as well as another ruling on access to abortions in an medical emergency situation, which also could have national implications. And so curious, we just have a few minutes left, whether you've seen that sort of believability gap change, or whether you're still seeing people say, oh, these abortion restrictions, that's not my problem.
People are very short term. The court makes a decision, it will emerge as an issue. The fact that we're debating this in the New York Times and the Washington Post and Politico and everything, it's something. I got a lot of problems in life. It's when they make the decision that suddenly, and a candidate for president has to say, I'm going to reverse that decision for that. But that doesn't mean that people are not interested. But there's so many threats. The court to decide to this. We could end the regulatory power. We could do this. We could do that. People have too much to worry about in their day-to-day lives, to worry about the courts. But when the court makes the decision and you want it reversed, then does the candidate for presidency say, you elect me, we're going to do this. And I'm going to have a Congress, and we're just going to reverse this, and enough is enough. And then they will share, people absolutely pay attention, and they'll shift the issues that they're voting on. But in this very short-term environment, you just can't get what we as experts do. We worry about they could do this, the Federal Reserve could do this or that. There could be a war in 8 years. People just don't do that. They're on a day-to-day basis. But the minute the decisions are made, it will change the political dynamic.
And we have just a couple minutes left. Jarrett, anything to add to that, or some main takeaways we haven't hit yet before we move to our other panel?
Yeah, I'll go back to just something that Bob touched on in his terrific opening remarks, and that is the revival of the repeal the ACA conversation when Donald Trump invoked that a couple of months ago, or 6 weeks ago, 8 weeks ago, however long it was. Look, Bob's exactly right. Voters don't want it. We have north of 60% of Americans who have a favorable view of the ACA today. That was right around 50% right before COVID, and now it's above 60%. So I think going through the pandemic made people more appreciative of some of the things in place. Our Republicans still don't like it. They still are against it. I think I don't know that ever really changes that dramatically. But independents, around 60% favorability towards the law. And look, if you are the Trump campaign and you want to win, if presumed candidate Trump campaign, you want to win, white suburban women in Maricopa County or in Fulton County, talking about repeal and replace is not a good strategy. I mean, we saw what happened in 2018. It caused, it led to a pretty big losses in the House for Republicans. And so I think, and you've seen some senators on the Republican side kind of try to, the issue a little bit. Because they know that the numbers just don't support, it may be popular in a Republican primary, but if you are, winning plus 50% in Iowa, you may not have to worry about that. It does not do as well in a general election environment.
Mm-hmm. Mm-hmm. That's a great point. And also how it, Trump may say something like that and it may not impact him, but it has a trickle down effect where everyone who might be running on the same ticket for Congress or for other positions will have to answer for it, and it could very much impact those races. Well, I want to thank you both so much, and we're going to transition now from hearing about where voters are at and what their feelings are about healthcare in this moment, which could obviously change depending on what happens over the next several months. So we're going to focus a little more on where things are at policy-wise right now, and thinking about some of the healthcare stakes of the elections later this year, especially those that voters may not realize. It could be a little more under the radar. And so we have two very knowledgeable speakers, very excited to hear from them. We have Chris Jennings and Sheila Burke. And so I would love to, going off of what we just heard about where the public is, wanted to get a few opening thoughts from both of you on the stakes of this election, especially the stakes that may not be as obvious as, Obamacare repeal or, appointing people to the Supreme Court who could, rule on healthcare issues. So I don't know if Sheila or Chris want to offer a couple thoughts first.
Chris, you want to begin?
I,
And I'll follow you.
I'd
as I
be
always
happy to
do.
begin. Alice, great to see you and great to be here again with BPC. I have a favorite comedian is Steve Martin, and he always used to quip that the great thing about the banjo is that it's impossible to sing a depressing song on a banjo. But after listening to Bob and Jarrett, I might say that they could play a depressing song on a banjo, listening to their findings. And I'm going to try to give a little bit more, optimism about the future. I do think I agree with everything they say on their findings, don't get me wrong. But to answer your question, Alice, I do think there are absolutely very defining issues that have healthcare links in this campaign. And part of that is related to the broader governance of the economy, which is cost and complexity of healthcare, as Bob said, is just a huge, huge issue across the board. And how you in conveying them in a thoughtful, meaningful way, particularly as it relates to things like prescription drugs and things that get their heads around. I think that is meaningful, and it's people are going to be debating that and pushing it and promoting it. And Donald Trump, of all people, knew this in 2016 and was talking about it as well. And you've seen the Biden administration do it time and time again, and I think you're going to see that even more so as we go forward. I think one thing we learned about healthcare and every issue, frankly, in politics is more people focus on issues when they think something that they value is going to be taken away from them. And I think that becomes a motivating issue. That's why abortion has become a very motivating issue. People are fearful that a right that they have access to, or they've relied upon forever as just a given, is now at threat. And I that's going to be very, very front and center. It is an issue. It is a healthcare issue. It will be front and center in this campaign at state and local and federal levels for sure. And of course, that will have implications about broader issues on the judiciary and courts interactions with federal policy, et cetera. I think there's just tons of other things. When I talk about takeaway, of course, when the former president talks about he's going to repeal and replace Obamacare again, you can be sure that the Democrats are going to be using that in the campaign, and it will be motivating. I think it will be motivating in very important ways because, he tried before. He says he's going to try again. Why would anyone suggest that he won't? So I'll stop with those three, but I think they're very, very significant motivating issues that will drive voters. And I think in the end of the day, when you really compare the two candidates and their threat of taking away things that people value, Joe Biden will do very well.
Thank you so much for that. Sheila, any opening thoughts, and then we can jump into some questions.
Thank you, Allison. And again, let me also join in thanking BPC as well as the Commonwealth Fund for supporting this. And my thanks to both Bob and Jarrett for, I don't know if I'd call it uplifting, but certainly an informative presentation of what we might expect. I, again, don't disagree with the points they've made, nor frankly with the points that Chris has made, but would make a couple of points. One, I would underscore Bob's point about the personal issues that are going to be at stake here. That people are thinking very short term. People are thinking very much about what they might lose, as Chris suggests, what might be at greatest risk for them. And what concerns me and sort of all the issues that Bob ran through, and as we look at the issues that may come up in the context of healthcare that are very personal are in fact issues around an individual family, their exposure in terms of cost, the complexity of the healthcare system leaves people gasping, their inability to navigate the system. The whole question of the sort of time it takes to actually access care, their ability to access care, the unique set of issues that are confronted by rural America that touch on both Democrats and Republicans as they try to figure out what the solution is to that, at the same time with people pushing back on what the role of the federal government should be. I think one of the greatest questions that we have to contend with is, in fact, what is the distribution of responsibility between the federal government and the state governments in terms of the provision of services, the quality of services, access to services. We saw the implications of states choosing not to expand Medicaid, for example. We're now slowly but surely seeing some of those states come into line with the rest of the country. But again, the disconnect between the feds and the states have enormous implications for individuals in terms of their access to services. There are certainly questions around maternal health. We are concerned increasingly about the increased maternal death rate and the risk of mortality among particularly communities of color and how that's being played out in terms of the state level. And it also calls into question one of the fundamental issues, which was raised as well by Bob and Jarrett, and that is the trust in the federal government to provide essentially a floor of support, whether it's in public health, and issues that the Trump administration raised about the role of government in terms of determining how one deals with the public health emergency. It has undercut support for those fundamentals. We've seen over a long period of time diminution of support for public health activities at the state level, which has raised serious concerns about our ability to respond to crises and what the role ought to be. And that's one that's getting fought in the courts and getting fought out at the federal and state level. And so your question about the implications of the election have enormous impact on those questions, which is who makes those decisions? How do we fund those activities? And whether or not we're able to continue our support for whether it's CDC, whether it's the FDA, and whether we've raised enough questions so that people question the judgments that are being made and the guidance that they're being given in terms of crises as they arise. So those issues, I think, are ones that complicate some of these questions. The issue of how one accesses information. Again, as Chris points out, pharmaceutical prices has been an issue under both the Trump administration and the Biden administration. It will play through. It will have implications for individuals in terms of their access to drugs. We don't yet know what the final result of that will be. But again, it'll be a question of the role of government in terms of how one plays out where the responsibility lies. So I think all of those issues are complicating ones, and they will play out differently in the inner city than they will in rural communities. But again, I think at the basic level is this question of what is the role of government and what is the role of the federal government and the role of the state government, and that gets fought out state by state in terms of these races. So I think all of those issues that have been raised, I think, are critical ones and will play out very differently.
And Alice, can I just say of course, Americans have always had a tension between their comfort and confidence in government's ability to deliver, and both parties have different views on this. But I will say that, when Bob talks about Medicare rightly as this huge core foundational issue, it's a real social contract, if you will. Those are the same people who say keep the government's hand off our Medicare.
Right.
And so I want to just put in the context that Medicare is almost bigger than that government discussion. And that's why when you throw in, should Medicare be permitted to negotiate prescription drugs? Of course, they're going to say, well, of course they should. Overwhelmingly bipartisan, and so it's a really interesting core issue that really reflects fundamental beliefs in certain core functionalities that government does play and must play to provide those basics. And if people are going to be talking about, to Bob's point, Medicare reform, or I'll give you an example, raising the eligibility age when people are like just hanging on just to get to 65 to get Medicare. That is just a huge political touch point that would drive people crazy. So it's important that's why both parties are going to be very, very sensitive on that issue. I assume we'll try to raise this on the Democratic side. Republicans will run away with it, run from them. But you know, what I'm more concerned about long term, if we have split government, or if Republicans take the agenda, I was actually more concerned about Medicaid as a program and the targets that it has become in the past and may become in the future, particularly in the broader context of government looking forward. So we've got to think about all these issues, but there's no question whether you want healthcare to be part of the agenda or not. It always is the part of every debate, every discussion, every budget discourse that we ever have.
You know, it's interesting. I mean, Chris raises an important point, and I would add to it in the following way. The question about the role of government, you know, we're focusing specifically on healthcare, but I think what we've come to find over time is that there are an enormous number of influences on healthcare. And the traditional healthcare programs, as Chris points out, Medicare, I mean, having lived through, as Chris did, the 83 reforms of Social Security and what it took to get us to that resolution in terms of Bob Dole and Pat Moynihan and Alan Greenspan and others finally coming together after it looked like there was no hope going forward. But there are other issues that have an impact. For example, the child nutrition programs. There is an underlying debate taking place about what the federal role ought to be with respect to the support of things like WIC or other nutrition programs or housing programs. And so this question about the role of the federal government, the distribution of those responsibilities, have an impact across the board, not only on the very specific healthcare programs as we know them, whether it's Medicare, Medicaid, as Chris suggests, is one that we should be concerned about, or what that distribution looks like, and who has fallen out of those programs. The number of disenrollments in terms of Medicaid over the last few years have been extraordinary and have an impact. Therefore, we see an increase in the role of the ACA in picking up some of those populations. But again, I think we can't look at healthcare as just the obvious programs, public health service programs, Medicare, Medicaid. We need to look across the board at the government's responsibility for lots of elements that have an impact.
Yeah, absolutely. And I mean, that's a good transition to, you know, I wanted to talk about the fact that, candidates may be talking about repealing Obamacare or, passing these sweeping national laws. We've seen Congress really struggle to do that even under one party control. And so I think it's really valuable to think through what different administrations would be able to do on the executive side, because that is, very powerful, often under the radar, has huge implications for healthcare. You mentioned drug price negotiation. A administration that is opposed to that could, throw a wrench in things if courts don't do it for them. When it comes to the regulation of medications under FDA, obviously, a lot of power there. What are sort of the stakes for healthcare that you see of the presidential election when it comes to rules and executive orders?
Well, the executive orders, and I'm sure Chris, having been part of the administration, will have views on this. Executive orders are often this sort of underwhelming, or not underwhelming, but unknown sort of tools that are available to an executive branch. We know that President Trump did 200 and something executive orders during the course of his 4 years. President Biden has done 120, 130 executive orders, and they touch on everything you could possibly imagine. President Trump, first out of the box, had an executive order calling on all of the agencies to do everything they could to undercut the ACA. We know that President Biden very early on had executive orders that looked at equity and looked at access in terms of education and issues with respect to certain populations. So it is a tool that is of use. Both executives have used them in recent years, all the way back through the history of executive orders, and they can be enormously important. First actions, sending a message, activating essentially the agencies. Congress doesn't review them. the agencies essentially are at the behest of the administration to essentially follow through on certain activities. So a change in administration or an existing administration can do an enormous amount in terms of changing direction, changing policy. Certainly when the Biden administration came in, they reversed a whole host of issues, executive orders that the Trump administration put in place. And again, I assume a Republican administration would essentially do the same thing and try to reverse some of the Biden activities.
And specifically, actually, Sheila's completely right. And of course, Alice, you know, the short-term limited duration, the
Yep.
association health plan issues. Who knows? Maybe they look at family glitch because they don't want to have more subsidies. You know, who knows? Really, the one thing about I should just say about executive actions and orders and directives, and we use the term interchangeably, is that frequently it's because the parties have decided that they can't get Congress to act legislatively. If you act legislatively, that becomes permanent law. If you act administratively, it's as long as that executive is in office or as long as that executive action continues and it hasn't been overturned. And so it is an important signal, but it is not a sustaining one, and it can't always be used. And it's used a lot, not just in healthcare, but in energy and a lot of other policies, as you know. But certainly abortion, Medicaid, insurance reforms, we see them used, as Sheila says, to signal priorities of administration and directionally where they're going, and to stop what they perceive as bad things from occurring. And also a sense that I can't wait for Congress to act, or Congress won't act, and I have the power to do this, so I'm going to do this. So yes, that's going to happen regardless. And I think the scary thing would be, from a Democratic perspective, is if a Republican comes in office, in particular if it's President Trump, he loves, to Sheila's point, loves executive orders, and anything his definition of something that's bad is if Biden or Obama did it. And so that to me is reckless, I'm sorry, and extraordinarily scary.
And you mentioned the
Can I say one other thing? Ask just 10 seconds.
Sure.
For you. I'm sure you're going to ask this, but how courts perceive these and
Yeah.
how they're reviewed and where they're reviewed, and not just by, state attorneys generals, but by stakeholders, we've seen this with surprise medical billing and a lot of the interpretation of laws and executive action. So they're very, very broad applications and implications relative to not just what the executive branch does, but what happens in the courts downstream and who are in those courts. So I just want to make sure you had the full color of the implications of the question you ask.
Yes, and no, that's a great point, because as Sheila noted, the Trump administration did a lot more total executive orders, but as we remember, a lot of those did get blocked in court because they violated, the Administrative Procedure Act,
Right.
or they didn't go about it by the book, let's just say, and so they did not all become law. And we've seen the Biden administration sort of take a more cautious approach, in the minds of some advocacy groups, too cautious, but they, want to make sure they withstand that court scrutiny.
Well, and Alice, the other interesting factor, of course, that we'll watch as we get towards the end of the year is the regulatory process and the Congressional Review Act, and whether or not this administration, as others have before them, try to put things out as quickly as they can so they're not subject to congressional review, because you also have an issue about the control in the House and Senate, and whether or not they in turn also look at recent actions by any administration and then try and reverse those actions when the new Congress begins. So there are lots of moving parts here that I'm sure the audience has lost track of the direction we're going here. But essentially, there are lots of tools available to both parties, and both the House, Senate, as well as the administration, in terms of moving an agenda. And to Chris's point, and your point, very often these tools are used when the Congress is unable to get to an answer or a conclusion on a variety of topics.
And I wanted to briefly touch on, you mentioned empowering Medicare to negotiate drug prices, which, the idea of that is very popular across the board. But I'm wondering, based on what we heard from our last panel about people only really being motivated by things that they feel the impact of personally, themselves and their family. And so, with the implementation timeline, is it going to be difficult for Biden to campaign on that as a win when those negotiations have only just started and people aren't seeing cheaper drug prices yet?
Well, they are and they aren't. I mean, we know the insulin changes have come into place. You're right. It is
But
a
just
more
within
difficult.
Medicare, right?
That's correct. But the question will be how it is in fact discussed. As Chris points out, how do you make it real? I mean, to Bob's point, it's all about the personal impact on an individual. I mean, the Medicare drug provisions essentially deal with Medicare. You've still got the large majority of the public that won't necessarily benefit. So the question is, how do the Democrats talk about what they achieved? How do they talk about and make it real in terms of what the implications will be on families in terms of drug prices? I mean, the exposure of these issues, the pressure on the pharmaceutical companies, but it is difficult because it is phased in over a period of time. And the question is, how do the Democrats make it real?
I guess I would say, as to your question too, is she was right. There's $35 cap. There's also the out-of-pocket cap for catastrophic that's already happening. The inflation protections that are happening that will save $400 per person already is in place. It's up to the administration to find creative ways to execute and to make sure people understand that and to make sure that those things are a risk, because there are people on Capitol Hill who want to repeal that very legislation. It's a very real threat. And so as long as they can break through on that, again, that becomes a really important point. This is my point about the takeaway. It's not just about how good you are about selling it. It's also about how good you are about, I'm sorry, giving some sort of sense of legitimate fear that it's at risk for losing something that you really do value. And I think this is going to be an important thing. Lastly, I did want to say before we wrap up, Alice, there are so many other sleeper issues downstream that we should someday talk about. We don't have time. I recognize this, but one big one that I just wanted to say is the whole burden that caregivers face, both for childcare and for elder care in this country. And the very fact that our baby boom population in 2021 started turning 75. It's a very, very frail population. Now, they're no longer the young elderly, they're becoming the older elderly. That whole issue of LTSs as long-term care supports and services and caregiving is going to be a bigger and bigger issue over time. Perhaps not in this election, but watch that going forward. I think that's going to get more and more attention, and it's going to play into a bigger issue about our workforce problems in this country and healthcare that people really want to see help with. And that probably will have bleeding downstream issues about why we need to do immigration reform. So I'm going to stop with that, but I just wanted to make sure people heard that there are big, big issues that we still have to face that real people, the people Bob and Jarrett have talked about, really do care about.
And let me underscore Chris's point. The issue of workforce, to Chris's point, particularly as it relates to long-term care services and supports, does get caught up in the immigration issue for sure. We have a workforce crisis in this country. We have a lot of people that are retiring, that are coming out of the workforce, nurses, physicians, and others, and a growing elderly population who have more comorbidities and more challenges. And we don't have, in fact, an organized system of long-term care services and delivery in this country. And there is no question that is going to be a complicating factor going forward. It is not a burden primarily on Medicare. It's primarily on Medicaid and on personal pocket. People pay out of pocket for most of those services, about 50%. So it is a huge issue for families in this country that has to be addressed. And my last issue would be particular attention to rural areas. I mean, as we are confronting these issues, there are particular challenges in those rural communities who have lost their hospitals. You lose the hospital, you lose the doc, you lose the nursing home, you lose the pharmacy. We have to underpin that system determine how best to deliver those services and by whom, and how best to finance it. But we can't leave the rural part of this country essentially on its own without some kind of support.
That's such a great point. And I mean, that just really illustrates why I love covering healthcare. It relates to every issue in ways that aren't always clear to folks. So, you know, who the next president is, who controls the next Congress, you know, things, related to immigration will have an impact on healthcare. Things related to climate and pollution regulation have an impact on healthcare. You know, things related to labor rights, it all feeds in and it all impacts, the care we receive, even when we can't always see those connections. So I really appreciate you taking the time to walk us through some of these issues. Of course, so much more to discuss. So hopefully we can reconvene and walk through some more of this. But really appreciate you two. Really appreciate our pollsters letting us know where the public is at and could be at leading up to November. And thank you to everyone who tuned in today. And have a great day.
Thank you. Great to be